Parkinson's disease. It is a degenerative disorder. Parkinson's disease is a chronic progressive neurologic disease affecting the brain centers responsible for control and regulation of movement. It is characterized by tremor, bradykinesia, rigidity, and postural abnormalities. Parkinson's can complicate the diagnosis, clinical course, and recovery from other illness. Approximately 1% of total population older than 60% is affected by idiopathic Parkinson's disease and is less commonly affects people of younger age. It is the second most common neurodegenerative disease. Pathophysiology and etiology. A deficiency of dopamine in the substantia nigra of the brain is thought to be responsible for the symptoms of Parkinsonism. Underlying etiology may be related to a virus, genetic susceptibility, toxicity, or other unknown cause. The clinical diagnosis of Parkinson's disease may be difficult because elderly patients may have other causes of rigidity, bradykinesia, and tremor. Clinical manifestation: bradykinesia, that is slowness of movement, loss of spontaneous movement, resting tremor of 4 to 5 Hz, rigidity in performance of all movements, autonomic disorders, sleeplessness, salivation, sweating, orthostatic hypotension, depression, dementia, mask-like faces, verbal fluency may be impaired, finger tapping responses are slowed. Assessment: obtain history of symptoms and their effect of functioning, assess cranial nerves, cerebellar function, that is coordination, and motor function, observe gait and performance of activities, assess speech for clarity and pace, assess for signs of depression, assess family dynamics, support systems, and access to social services. Elderly patients may have reduced tolerance to anti-Parkinson's drugs and may require smaller doses. Watch for and report psychiatric reactions such as anxiety and confusion, cardiac effects such as orthostatic hypotension and pulse irregularity, and blepharospasm, that is twitching of the eyelid. Blepharospasm on early sign of toxicity. Diagnostic evaluation: observation of clinical symptoms may do imaging studies to rule out other disorders. Physical examination of upper extremity elbow flexion extension reveals rigidity on extension. Sensomotor assessment of grip reveals abnormally high grip forces and longer than normal to complete object lift, particularly with lighter loads. Favorable response to a single dose of levodopa helps confirm the diagnosis. Management: pharmacologic management, anticholinergics to reduce transmission of cholinergic pathways, which are thought to be overactive when dopamine is deficient. Amantadine, Symetrel, Symmmetrel, Symetrel, which is thought to increase release of dopamine in the brain. Levodopa, a dopamine precursor, combined with carbidopa and decarboxylase inhibitor to inhibit destruction of L-dopa in the bloodstream, making more available to the brain. The combination of levodopa, carbidopa, that is cinemet, usually is used. Bromocriptine, parlodel, 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 a dopaminergic agonist that activates dopamine receptors in the brain. Use of the monoamine oxidase inhibitor selegiline, that is Eldipril, Eldeprol, Eldipril, to delay the onset of disability and need for levodopa therapy. Tolcapone, Tosmar, Tolcapone, Tolcapone is the new drug class. COMD inhibitors for adjunct treatment. Surgical treatment: new surgical treatments for Parkinson's disease and essential tremor are promising. Medical Pallidotomy often improves long-standing symptoms such as dyskinesia, akinesia, rigidity, and tremor. Chronic deep vein stimulation of the thalamus decreases tremor and responsiveness to medication. Complications: dementia, aspiration, injury from falls. Nursing interventions based on improving mobility, optimizing nutritional status, maximizing communication ability, preventing constipation, strengthening coping ability, and community and home care considerations. Patient education: instruct patient to avoid sedatives, instruct patient to medication regime, stick to the medication regime, encourage follow-up monitoring for diabetes, glaucoma, hepatotoxicity, and anemia while undergoing drug therapy. Teach patient ambulation causes, avoid freezing in place and possibility avoid falls by doing one of the following: raise head, raise toes, then rock from one foot to another while bending knees slightly. Raise arms in a sudden short motion. Take a small step backward and start forward. Step sideways, then start forward. Instruct the family not to pull patient during episodes of freezing, which increases the problem and may cause falling. Thank you.